if it's going to be in the metaverse, that means that these are services that will be integrated, but how do we get physical medical services in the metaverse? So I will ask you a question. When do you need to see patients to diagnose something? How many diagnostics can be done without a physical presence?
I don't think you're going to get rid of like patient care and direct patient contact, but I think it's going to be a supplement to patient care. It's an add-on. And then, like I said, it can offload some of the busy work that physicians are doing now. So you can do like point of care at home. Maybe they can do some sensors and questionnaires. So when you see your doctor, everything's already packaged off. And then you have more personal time to actually address what's concerning you.
And there's a lot of, I think, remote patient monitoring devices now that we can use as well, right?
Yeah, actually one of our partners is, there he is in the back, News Logic, HU, that's it, that's your gangster rap name. But one of our partners is here, and he has a bunch of connected health apps and wearables. Every time I have lunch with this guy, he's got a new thing strapped to his body. One day he had this thing on his chest. The other day he had a thing on his knee for, what was it, range of motion, correct? Yeah, range of motion. So like if you had knee surgery, you can wear this device to where it can track your range of motion and things like that. So we see with the metaverse as being just a conduit to where, I hate to use the word board, but we'll be walking around with sensors, which we do every day. I'm wearing a watch that's tracking all kind of healthcare stuff for me. Pretty much everybody in here is wearing some form of a watch or a band or something like that. So, we need to be able to take advantage of that data and be able to use it to make our health better, and at the same time, help the consumer monetize that information that they're giving away for free right now.
Talking about monetization. Stephen, can you talk a little bit about how do people pay for services on the metaverse, and also how do they, I heard Nick talk about reward. Can we talk about reward and paying for services?
Yeah, so we're going to be launching our ICO for the MedV token today. So it's basically a activity token, a social token that incentivizes the users to engage with the healthcare community as well as adopt healthy habits. So imagine, if you will, you go see your doctor and you get a token. You do your immunization, get a token. You're doing something to drop your blood pressure down to the normal level, you get a token. So it's just an engagement type of token that sort of like activates the patient to be more of a healthcare partner with the healthcare system. And I think that's our goal, is really to activate, sort of like the key to the metaverse.
Well, and the big part of that, right, is the fact that that token, it can be used for, trading between services within the metaverse. It can be used for services in the real world, or, it can be used to, pay back themselves. It's a tradable cryptocurrency that has all of those types of features, the same tradability, the transfer function, the buy, the sell, things like that you would normally see in a cryptocurrency. But it's specifically catered towards benefiting the healthcare and the fitness and the health rewards, right?
And one thing I see before we finish is, unlike in other parts of the world where they actually have free healthcare, we don't. But I look at it this way: if you can do things that incentivize your health and get rewards for it, you can ultimately have free healthcare. You can literally pay for your healthcare by just doing everyday things to be healthier.
So that means if I'm taking my 10,000 steps a day, if I go to the gym, if I do follow what the doctor says, I earn token, then I could actually exchange them for fiat money, pay my health insurance. Is that where you're going with this?
That's where I'm going with this.
Yeah.
Which makes sense, right? Or I can use them to actually pay for services or get discounts in places like 247 Health Solutions, right?
It makes sense. Like, the consumer needs to be incentivized. I mean, everyone else is incentivized, the hospitals, the physicians, the labs, the pharmaceuticals, but the consumer is not being incentivized monetarily. And then we want to change that narrative so they are incentivized, and they're actually the key component to any outcome.
Stephen, why is it important to start from a blank slate and not necessarily let the big pharma and the insurance companies and the government decide what's going to be?
Well, like, are we the same as like we were like 50 years ago? We're not, right? But healthcare is managed the same way, like 30 years, 20 years, 50 years ago. It's the same thing. It's top down. So it's like the executives design the healthcare system, the hospitals and the physicians, and down below they ask the consumers. We want to really flip it over. And then MDDAO, one of the most important thing about the MDDAO is that it's going to give us insight into what truly is happening in the healthcare system. Not my opinion, not Arabian's opinion, but their opinion, your opinion. And our job is actually to interpret that data set and then to create like a iteration that's more personalized, more intuitive, and more rewarding for us.